So that's also really important. So we're going to go ahead and get started. I'm going to introduce myself, and Dina is going to start the presentation. I'm Dr. Eliana Aaron. I'm the director of EmaCare. A lot of you know me from the COVID WhatsApp groups that I stay up till 2 in the morning doing. Our videos are gap year groups. I'm the director of EmaCare. As I said before, we're sponsoring this very important session about the COVID vaccine, and we're featuring Dr. Dina Zimmerman. Dina Zimmerman is the Director of Maternal, Child, and Adolescent Health in the Public Health Department of the Israel Ministry of Health. And here we go. You can see her official title in the Public Health Service. The Public Health Service is the department that's really very much involved in everything corona related. So she's right there in the hot seat. She's also a Yoetz Halacha scholar, a public health expert, lactation expert, and has written many books and articles on these subjects. So Dina, take it away.
Okay, good evening to everybody. Hopefully using not my computer. Okay, trying to go to the next slide. All right, we're going to start off with, once I can get the slides to move, we're going to start off with just a little bit of background in terms of corona to make sure that we have some of the basic terminology and knowledge about the virus. And then most of this talk is going to be related to the vaccine. Okay. So to be able to understand some of the discussions I'm going to have later on about the vaccine, I just want to go over some basic things, such as what is a virus? A virus, by definition, has genetic material in the middle. Sometimes it's DNA, sometimes it's RNA. It has proteins surrounding it. As we can see on the bottom left, it comes in lots of different sizes and shapes. And as you can see on the right, the way that viruses work is that they cannot replicate by themselves. And therefore, in order to make more viruses, they have to attack some sort of host cell. It can be human, it could be animal. They come to the outside of the cell, the genetic material is put into the cell, and it overtakes the mechanism of the cell itself in terms of reproducing, and it's able to make material, which then is exuded from the cell and released, and that's what infects the host. Okay. Now, in the process of dealing with this pandemic, what has been important, and not just what our virus is, but how our viruses spread. And different viruses spread in different ways. They tend to have their favorite way of doing it. So some well-known airborne viruses are Ebola, measles. There are other viruses that are spread by droplets, such as seasonal influenza, rhinovirus, or the common cold. There are viruses that are spread through contact with body fluids, such as blood, such as hepatitis B. There's some that are spread through sexual contact, such as AIDS and hepatitis B, which also points out that sometimes there can be more than one kind of viral spread. And there's some that are spread by pure hygiene, or what is known as fecal oral. And those are things such as an Norwalk agent and rotavirus. Now, SARS has been around just about a year at this point. And over that year, there are things that have been learned about it, though we also have to remember it's only been around a year, and therefore there are things about this to which the answer still is we don't know yet. But what we do know is that it is a virus. It tends to look like the picture on the left, which is somewhat reminiscent of a crown, which is how it got its name. Its main method of spread is through droplet spread, which means somebody coughs, somebody sneezes, and it can be spread in that way to the next person. Generally, it has to touch either the person's mouth or nose in order to enter the second person's body. And from this understanding, we also can understand the prevention methods that we've been hearing over and over again for the last 8 or so months about the importance of wearing a mask, because if somebody sneezes into a mask, it's not going to go quite as far. And if it does go some difference and the other person's wearing a mask, it's not going to get into their body so easily. The importance of having a distance between people. You look around the world, it's somewhere between 1.5 meters. In Israel, 2 meters. The idea is if people are not that close, even if somebody does sneeze or cough, the virus won't get to the second person. We want to prevent congregation of people, because the more people that are around, the more likely they are to be close to each other, and the more people that are there to be potentially infected and to spread it around. Now, there was a lot of talk about can the virus be spread on contact? Now, if you have somebody who has just sneezed onto someone and someone touches it and then directly touches their mouth, their nose, the answer is yes, it could be spread that way. But if one puts the emphasis on hygiene and washing one's hands, then that's not a major method of spread. Can it be spread through the air? In some cases, probably. All right, most of the cases where that's thought that that was the case is generally when people were in closed rooms for a long period of time, which is why part of the recommendations are also leave windows open, try to be outside as much as possible if one needs to be together with other people. Now, what has changed in the last approximately 6 weeks, right? And I think it's important for us to remember that's just about when the first vaccines were permitted for use, was the middle of December. We have a whole new part of the discussion of how one can potentially control getting this virus, and that is the vaccines. The 2 vaccines that exist in Israel both work on the same technology, and that's the technology we're going to talk about tonight. It might be in the future there'll be a need to talk about other kinds as well, but this is what we have in Israel. This is what we know the most about, and therefore I'm focusing on this. These are known as mRNA vaccines, and they're a technology that's actually been around approximately 10 years. They were never fully developed totally till the end, because by the time they got to doing certain earlier things, the previous viruses had kind of died out on their own. But it's not like it's not something that hasn't been investigated for a long time. It's been investigated for about a decade. Now, most of the vaccines that we are used to either involved giving a live but somewhat weakened virus, or giving a virus, or giving part of the virus coat. All right, if I went through all the vaccines which were most familiar from childhood, they would fit into one of these categories. And here they went one step further. That instead of actually giving the body the foreign protein and having it produce antibodies, what they did is produce in advance the strand of mRNA. mRNA is basically the recipe for that protein, okay? So it's the spike protein, the S protein, that these vaccines are targeted at. And it was definitely a stroke of good luck that the protein that was chosen to focus on in developing the vaccines, they guessed right. All right, so we're basically giving the body not the protein, not part of the protein, but rather the recipe for the protein. The recipe of the protein goes into the cell, not the nucleus. And because it does not go into the nucleus, it cannot do anything to the person's native DNA. It just doesn't get in there. It can't get in there. Rather, it stays in the outside part of the cell. It interacts with the mechanism, the natural mechanism of the cell, which is meant to produce proteins. And the protein the cell will produce are this spike protein. Spike protein goes to the outside of the cell, and the body, like it does to any other kind of new protein inside the body, produces an immune response. It actually produces two different kinds of immune response, one of which is antibodies, and the other which are particular kinds of cells, which are also part of our immune system. Now, what are the implications of
Hold on,
vaccination?
wait a second, Dina,
So the
I
implication,
apologize, Dina, I have questions. Yes, we have questions first.
Sure.
Okay, can we go back?
Fine, very good.
Even better.
So
Great. So we
I
can,
have,
no problem.
yes.
So
far we've gotten to pretty much we've talked so far about what the vaccine is and how it works. So right now we'll deal with questions that are about how the vaccine works and things related to that. So go right ahead.
So is question number one, is it worth waiting for a non-mRNA vaccine?
Okay, I can't think of any reason why one would want to wait for a non-mRNA vaccine, because this is probably one of the most elegant technologies that have been produced recently, okay? Because what we want in a vaccine is for the body to produce an immune response, but we don't want to have the potential of transmitting the disease. When we're using vaccines that are based on killed or attenuated viruses, there is that really, really small chance that maybe one will get a mild form of the disease. And in this technology, it is impossible to produce the disease because you are not giving anything related to the virus itself. So I don't see any reason why one would want to wait for an older technology.
Do you anticipate that we will need other vaccines for any mutations of this virus?
I have a kind of joke that prophecy is not one of the courses in medical school. Okay, so I can't say for sure what is going to happen in the future. But with the variants that we are aware of at this point, it appears that the vaccine still is effective, because where the variants are having their variation is not in the spike protein to which we are making the response. And one of the beauty of this new technology of the mRNA is that it is relatively easy to change the recipe. Okay, so unlike in the past, when a vaccine would no longer be defective and one has to come up with a new one, it would take a much longer time. There's reason to hope that even if at some point we have to change it, we have the ability to do so.
Is there any way, and I know you said this already, but I want to make it super clear because I've gotten like 30 questions like this. Does this mRNA vaccine enter the cells of our nucleus and change our DNA or our own RNA or anything like that?
Okay, as I said, it enters the cell, the body of the cell, but it does not enter the nucleus. Our DNA is only in the nucleus, and therefore it cannot alter our DNA in any manner, shape, or form.
Okay. If this is, again, these are very general questions about the vaccine. How long can someone expect to be immune to COVID-19 after getting 2 shots? I think that goes to your predicting the future question.
Exactly. It hasn't been around long enough for us to know. We have reason to be hopeful that we're talking in about at least 6 months, and that's why many of the guidelines in Israel right now say for 6 months. That doesn't mean we know it's not effective in 6 months. It means that when we get closer to 6 months and we have more data, the issue will have to be examined again.
Is it better to get corona and get natural antibodies versus injecting this into our bodies?
I missed that. There was a little bit unstable. So if you could say that last question again.
No problem. Is it better to get corona naturally and to have natural immunity versus getting a vaccine?
In general, it is not better to wait for natural immunity rather than getting the vaccine, because we are always balancing the effects of the illness against the potential effects of a vaccine. We know this We know this virus is potentially fatal. We know this virus has long-term consequences, and we don't even know what all the long-term consequences are. So there's no reason to wait to be infected, to possibly get immune, rather than taking the vaccine, which cannot make me sick, okay? And it may even provide better immunity than natural disease. I mean, it's a little bit early in the process to know for sure, but there's some reason, some tests have shown, some studies at least have shown that you actually have more antibodies after the vaccine than you do after the disease.
Okay. If you get both of the vaccines and then you encounter someone who's positive, do you have to go into quarantine? And this is the last question in this section.
Okay, well, it depends when you meet that person, okay? The definition of when you were considered fully immunized is on the 8th day after your second vaccine. In other words, a full week has passed since you have gotten your last vaccine, and then you are considered immunized. Should you have run into that person 2 days after getting the vaccine, the second dose, then you have to go into quarantine. But if you have met him on day 8, 9, 10, you don't have to. And one of the questions that I just saw popped up here, which I will relate to at this point, is, what's the difference between a mutant and a variant? And the answer is that there really isn't, but variant is probably a better term, because mutant starts to make us think of turtles that grew out of the sewer and things of that sort. And really, we're just talking about, natural variation that happens in viruses all the time.
Okay. Please continue your lecture, and I'll ask questions after the next section.
Okay, so I'm going back to share screen. And okay. So the next thing is, what are the implications of vaccination? So the most important implication of vaccination, that you have a 95% less likely to get sick, okay? From the data that we have from the vaccines that we've had over the last number of months, it seems to be a very effective vaccine. 95% was higher than was hoped in the past, and is higher than a lot of vaccines that we rely on a ongoing basis. And the main point of the whole idea of vaccinating is not to have people get sick, and particularly not to have people get seriously ill and flood the medical system. Okay? Now, what are the legal implications of vaccination? Number one, as I discussed a minute ago, right now it means that if you're exposed after you have finished the amount of time from the vaccination, you don't have to go into quarantine. In the future, it may have other implications, such you may be able to go into events and malls, etc. There has been talk about a green passport, but this doesn't actually exist yet. It's still being discussed. It's part of the idea that if we have people who we know are already vaccinated, or people who have recovered for the disease, or people who were just tested in the last day or two and they were negative, and we allow them to be in slightly bigger gatherings, the risk that we are taking is lower than people that don't have these categories. How exactly that is going to work has not yet been finalized. There are a lot of legal implications that still have to be discussed, because in Israel it is against the law to force people to be immunized, and therefore if the only option to getting something good is that you're immunized, that's probably not good enough. So, you have to sit around and wait till this is finished to know exactly what this is going to mean in the future, because it hasn't been decided yet. Even when it is decided, it's important to realize that it's going to be time dependent, 6 months, 9 months, okay, for the reasons we discussed before. And then as we know more about the virus, then it could potentially be extended. There may be a discussion at that point. Is there a need for any kind of booster vaccines? We basically just don't know at this point.
Okay.
Do you have any questions?
Yes, we do.
this one?
We have questions. If a person
Okay.
is fully vaccinated, can they knowingly come into contact or live with a person who is in isolation or infected, and then to continue to interact with others at the same time, like going shopping?
Okay, so this is one of the things which is a little bit tricky, because the testing on the vaccine was done to find out that the person themselves did not get sick. On that, we have good data. We don't know 100% yet if it is possible that the vaccinated person has the disease. I mean, he doesn't have the disease in terms of being able to get sick, but it is possible for him to pass it on to others. We do have this kind of model from other viruses, okay, such as with polio vaccine. Those of you who remember one of our last major immunization pushes in this country, which is about 6-7 years ago, was to go back to giving the inactivated polio vaccine, the shot, as opposed giving the drops as opposed to the shot, because it was shown that using the shot alone could prevent people from getting polio, but didn't necessarily prevent them from being able to shed the virus. So we don't know at this point what the story is in this case. So we're kind of walking a tightrope. On the one hand, we know it is definitely going to help, and we want people to be immunized, and immunization is going to help in terms of the spread of the serious disease. However, we don't want, at this point, till we have more data, to just jump in and say that everything can go back to the way it is, because we don't know if you could be getting it and spreading it, all right? And that is why, if somebody has a known sick person in their house, that other person should be put in real isolation, should be kept separately. One should not be knowingly trying to be in contact with them and then in contact with other people, because that potentially could be spreading the disease. On the other hand, the person does not technically need to be in quarantine because they were exposed, because they were vaccinated.
Okay, so finding that balance. If we have received vaccines out of the country, will they be recognized in Israel for quarantine exemption?
Okay. At the moment, the answer is no. Okay. It is one of the issues that is being discussed. There are two things that need to be decided here. Number one, which vaccines are going to be recognized, because there are many being given in different parts of the world, and one needs to decide which meet the standards to which Israel wants to make sure people are vaccinated. And the second is to make sure that the documentation that is being brought from other countries is accurate and there is no forgery involved. I mean, one of the advantages that Israel has is that every single dose has been, put into a centralized system, and therefore it is hard for somebody to be able to say that they were vaccinated when they were not. Once you're coming from another country where you don't have access to the medical records, it's a little bit harder to be sure. This is something that's being worked on an international level in terms of international treaties between countries recognizing each other's vaccines. So in the future, there probably will be some sort of arrangement, but at this point, one should not say, oh, I was vaccinated in the States, I don't have to worry, or some any other country, because they're not being accepted at this point.
Are non-Israelis eligible for a green passport after getting an Israeli vaccine?
Okay, so anybody who was vaccinated, I have to go back again to the concept of the green passport, and they may even change the terminology, because there's been objection to using the terminology of passport, because it makes it sound like you're entitled to something. There is, as I mentioned, a process underway saying that if you meet certain criteria, then you will be allowed into certain events. One of those criteria is vaccination, in this country as of now. Other options are being tested, okay? soon before the event. Other possibilities are being able to prove that one actually has had the virus, either through having had a positive PCR test or having positive serology.
We're going to get to that later, though, the serology questions.
Yeah.
Okay. How can children travel safely, relatively safely on an airplane, considering they can't get vaccinated, as far as implications of the vaccine?
They should wear their masks while they're on the plane. Okay. Interestingly enough, apparently the air exchange on airplanes is far better than we think. So it's not being on an airplane that is the biggest risk. The risk is much more the issue of being at the airport with other people. And the way at this point to protect children is to make sure that they are wearing their masks, that they are keeping 2 meters away from people, that they're not being in big congregations. And as many people that they're with on a day-to-day basis are immunized, we're also minimizing the chance of them or at least catching it from family members.
Okay, please continue.
Okay. Just test it. Cooperate. Okay. So next question has to do with, contraindications. Who can't get the vaccine? And the list is actually very short, because even though it looks like a long list on the left-hand side, all these things are very unusual. Okay. As far as allergies are concerned, the only allergy that says you really cannot get this vaccine in any circumstances is if you have had a known serious reaction like anaphylaxis, having difficulty breathing, having one's blood pressure go down, things of that level, to the PEG, the polyethylene glycol, that is used as part of the preservation of the virus. If one has had this kind of severe reaction to multiple drugs that are given by injection, okay, so not just if one has an allergy to penicillin, even if that is the serious reaction like anaphylaxis, that would not be an absolute contraindication. If there is somebody who has this kind of anaphylaxis for no reason whatsoever, and if someone has a real problem with their immune system called a mast cell disease, those are the only allergic reasons not to get this vaccine. I know there was a lot of talk at the beginning about allergies, but this is what has been decided is really a problem. Other people that have had severe reactions to other medications, so it's a good idea to give it to them in a protected environment. What do I mean by a protected environment? In a place that if they should have some sort of reaction, there's somebody around to be able to give them epinephrine and take care of it. Okay, but is not considered a reason that one cannot get the vaccine. Another reason for which the vaccine will not be given in Israel at this point is if somebody already has the disease. And this was a conscious decision that was made by the Ministry of Health, saying that we know you have immunity for a certain amount of period from the natural disease. We don't know that getting the shot makes it go on for any longer. We don't know if by giving the shot we are boosting your system up maybe a little bit faster than we want, and therefore at this point we are not giving the shot to anybody who has the disease. Are there countries who are doing this? Yes. May it change in the future? Maybe. But right now, anybody who has been shown to have the disease, even if they were halfway through the process, they got one shot, then they got sick, they didn't have a chance to get the second shot, they are not getting another vaccination. The only exception to this rule, in certain cases when we're talking about nursing home residents that A, we're so worried about the possibility of their getting sick, and B, the trying to get them a shot at another point in the future is so complicated. In those rare circumstances, maybe, but in general, for most of the general public, if you have the disease, you are no longer eligible for the shot because it's felt that you don't need it. All right, there's advice to wait for a week from previous vaccines, but this is not actually a contraindication. It's just that this helps tell the difference if you're having any kind of side effects. Was it a side effect to the first vaccine or the second vaccine?
Is there any, you don't have to turn off your share screen, by the way.
Okay.
What do you do if somebody's doctor said they don't need to be vaccinated? Is there any
I think
recourse
it's
for
very
people?
important if someone's, there's always a recourse for people. First of all, I think it's important to discuss with one's doctor what the reasoning is. Okay, what is the concern? Maybe there's some inaccurate information on one side or the other. And if what one has heard from one's doctor does not seem to jive with what has heard in other places, one is always entitled to get a second opinion in the Israeli system. So feel free to ask again.
Is there any connection between, you mentioned getting another shot, between getting a flu shot and getting more severe COVID symptoms? Is there any connection at all?
Not that we have seen this year. I mean, one of the interesting things this year is we saw almost no influenza. Part of the reason for that is because the steps that one takes, it's another droplet spread disease, and we've been putting so much effort in spreading droplet diseases that it seems to have made an impact on influenza itself, which is perhaps something we should take in mind for the future, to try to prevent seasonal flu, which actually also unfortunately kills a lot of people over the course every year. And it shows that sometimes really low-tech interventions make a difference.
Sure. Okay.
Okay. So what about side effects of the vaccination? I'm dividing them up into things that are very, very rare, but they're significant, okay, and they should be mentioned to one healthcare provider. And that's primarily having a significant allergic reaction. Should that happen, one needs to discuss with the MD if and how to get the second shot. By if the allergic reaction was at the rate that it was, an anaphylactic reaction, and then one realizes, oh yes, I'm allergic to something else, there may be a decision to say, okay, the risk in this particular case of the vaccine may be more than the risk of the disease. All right. But in more cases than that, it would be, all right, we had somewhat of a reaction. The next time you get it, I want you to get it in a protected environment, as I discussed at the same time. In terms of, common side effects, and I'm using the word common very, very loosely, because it's only right now that we're really trying to gather the percentages, and there's no really great way to do this, because there's a tendency that the people who have symptoms are more likely to report it than the people who don't have symptoms. So I can't give any exact numbers here, but it's logical that there are people who have pain at the site, and I apologize for that spelling mistake. It's SIT. Too many years here in this country to spell correctly. And second of all, some people say that they have like a flu-like feeling. Okay, a little bit of joint pain, a little bit of muscle pain, with or without some fever. These are the side effects, that it's a side effect of getting a vaccine. It happens in many vaccines, not a reason to be particularly concerned.
What are the long-term effects of COVID versus the vaccine? Like, how can you compare those things? Very briefly, I realize that could be quite extensive.
Right. So I think in any time that one's doing a vaccination, it's a matter of balancing the vaccine as opposed to the illness. A good case of COVID would be one of having fatigue, flu-like symptoms, cough, and sneezing, which is far more than what I've described under the common, annoying, but not concerning side effects. We know that COVID can kill. We know that many people, they're talking nowadays of a post-corona syndrome, of people who feel that they're just not getting their thought process back, that it takes them a long time to recover from this. People who've had lungs that are damaged, kidneys that are damaged. There's been some discussion in the literature of overall unknown cases of death that it wasn't necessarily realized that they had corona, they weren't tested for it, but we're seeing more deaths than we have in the future. So there are a lot of reasons to be concerned about the disease itself, and much less to be concerned about the vaccine.
Thank you.
Okay, so we're talking about a new vaccine. And when you have a new vaccine, it has to actually get to the country. There has to be a way to give it out. You have to wait till it gets produced. And in this, Israel has been absolutely amazing in terms of how fast it is getting its population vaccinated. They're talking about 33%. About a third of Israel's population has been vaccinated at this point. And if you realize that at this point, a third of Israel's population cannot be vaccinated because they are under the age of 16.
It's like 60%.
Like 50, we're
50,
talking about
50%.
Over half of the eligible population has already been immunized. Even though we've gotten the shots, there are lots of shots, overall, there is not expected to be a shortage of vaccines. Israel has ordered enough vaccines for every single citizen in the country, plus it doesn't all get here at the same time. There are logistic issues involved in making sure that one is getting it out to all the places that needs to be. And therefore, there was put in a series of prioritization. The series of prioritization is an external an external
committee
body that meets and talks about it. And the first priority that started with that everyone was by age. Okay, and Israel decided over age 60. And the reason for this is one of the striking things about COVID-19 is the percentage of death in the older population compared to the younger population. I think it's important to stress that it doesn't mean there are deaths in the younger population. There have now been 4 pediatric deaths in Israel, and therefore this should not just be felt, oh, it's nothing, all right? And we don't know what the long-term consequences are, but the mortality rate is greater the older one gets, and therefore the first priority was put on age. Missing in this slide in prioritization at the same time as the elderly age was also the issue of healthcare workers. Okay, people who are going to be exposed to corona patients on a daily basis. And after the healthcare workers, then came the educational workers who are also exposed to children on an ongoing basis. So the age has slowly but surely been working its way down. Okay, first it was over 60, then it was over 50, then it was over 40. Then they added the 11th, 12th graders. And the reason the 11th to 12th graders is the hopes that we could actually get them to do their Bagriot this year without having to worry about being in Bidud. It was a little bit tricky how to define 11th and 12th grade because we have 3 different school systems in this country. Not everyone is in the same age group. That's also an age group that can get it because usually you're over 16 in those grades. But we didn't have to spend too much time defining it because within a week they decided they're giving it basically at this point to everyone over the age of 16. At earlier stages of these prioritization, there were also certain prioritizations based on medical conditions. The biggest concern was people who were immunocompromised, people who had pre-existing lung disease, and a relatively recent addition to this has been the whole discussion of pregnancy, but I'm not going to go into that now because later on in the lecture, we're going to go into pregnancy in depth.
Why aren't children able to get the vaccine?
Okay, so children, every time one tests a new medicine, one tests it on certain populations, and sensitive populations often are not part of these studies, okay? Therefore, in the original studies, for example, pregnant women were not put there, just because no one wants to do an experiment on pregnant women. And the same way, people don't want to do experiments on children under 18, if for no other reason that it technically gets very difficult in terms of getting informed consent, because you can't get informed consent for the person doing it. You'll have to get it through the parents. It's much harder to get approval for it. So it is not uncommon for things not to be tested in children, something that all pediatricians are aware of, because many of the drugs that we use have never technically been approved for use in children that we're using it in all the time, because people just don't do the studies. So of the two vaccines, one of them was tested up to age 18, one of them was tested from 16 and above. There are studies at the moment testing ages 12 to 16, and the policy at the moment is that we are not giving it to children, except for certain rare exceptions for which one has to apply. And the rare exceptions are primarily related to people who have significant medical conditions that put them at particularly high risk.
Well, when will people who had corona be able to get the vaccine?
There is no rush at this point to try to give the vaccine to people who already had corona, because as far as we know right now, it does not provide any additional benefit over those who have had the natural disease. So it's a question that gets looked at, but I don't see it happening in the near future. Certainly the emphasis is going to be first to make sure everybody has been protected in one way before we start wondering whether we should be doing double protection or not.
Are there specific concerns about young adults or teenagers receiving the vaccine? I know you're going to talk about fertility later, but are there any other concerns?
No, there are no other concerns.
Can non-Israelis get vaccinated? We could answer this very briefly if you'd like.
Okay, at this point, there is no way for someone to get it without going through some Kupat Cholim, because all the arrangements that the government is making for the vaccines are either through the Kupat Cholim or through the army, but that's another, the army gets its own vaccines and deals with it within its own health service. So there are tourists who have insurance through the Kupot Cholim, through the health funds, and as in anyone else who's covered by the health funds, they can be covered. There is discussion about making sure that people who don't have Kupat Cholim and don't have any other insurance, such as undocumented workers, will get the vaccine so they can't spread the disease to others. There are certain cities who've been trying to make sure that they have these undocumented workers done. But pretty much the way at the moment for somebody who is a tourist is to have insurance in some manner, shape, or form through one of the health funds.
Thank you.
Okay, and this stresses something that I mentioned before, that we don't know 100% if this vaccine is preventing us from spreading the disease. We know it prevents us from getting the disease, but until we have more information, it is important to still wear the mask. It's important to still stay the 2 meters apart. It's important to still wash one's hands frequently. And it is important to continue to have the size gatherings according to the guidelines that are issued at the time, okay? I'm aware that these guidelines change frequently. They change frequently because it's an ongoing emphasis, on the one hand, to try to get some form of normality back to life, but on the other hand, keep the numbers at something that the hospital system can manage, and it's been challenging.
Okay. I have a question that's been asked by over 100 people just to me. Do I need to wear a mask in the following situations: hugging or visiting my grandchildren and eating out in a restaurant?
Okay, so when we get to the point that one can eat in a restaurant again,
obviously,
then the guidelines will be the same as they had been in the past, that there are times where one has to take off one's mask, such as eating. Okay, and that is one of the risks that are involved in activities that involve eating, is because you have to be without a mask, and that is part of the thought process in terms of when are we letting the restaurants open up or not. On the other hand, as far as visiting people who don't live in one's household, okay, I wouldn't rush not to wear masks. Okay, because realize you've done something by vaccinating to protect yourself. However, if one is going to have real close contact, hugging, kissing, whatever, with grandchildren, and then go on and see other people, you don't know that you're not being part of the disease spread. So I think it is wise, for till we have more information in the foreseeable future, take this as an opportunity to see them, maybe a quick, rub on the shoulder and then go wash your hands kind of things, but still realize that the issue of possible disease spread has not disappeared and we still need to be responsible.
Okay. And can a group of people who have all had their second vaccines for a few weeks comfortably be indoors and unmasked? A lot of people asking about Super Bowl parties.
Super Bowl parties are an issue for two reasons. Number one, I've yet to see the Super Bowl party where one doesn't eat. And therefore, having your mask off, eating, being a long time in the house with the windows closed because it's in the middle, this is a setup for disease spreading. Okay. So for the people who are sitting together in there who are all vaccinated, the risk is low to them, but there's still the risk of them being able to spread their disease to other people's. I'm also not sure what the size of the gathering that will be allowed by Super Bowl Sunday at that time. So that should be taken into consideration as well.
Okay.
I think we should be very glad that we have this vaccine. I think it definitely should reduce the level of worry of the high-risk population, okay? But I do not think we should, at the point right now, that we should say, okay, I can do everything that I can before just because I'm vaccinated. We're not there yet, okay? Hopefully we'll get there. As months go by, we have more information, and then, people are looking at this all the time because there definitely is an interest of going back. But one should not take a big jump to normality yet.
Okay, thank you.
Okay, so I want to talk about the issue specifically related to fertility, because I think this has been one of the most discussed issues about the, about the vaccine. I am the head of the maternal child division, so maybe I'm a little bit biased because those are specifically the questions that come to me, but it's just been unbelievable how many times people have asked this question, and therefore I'm going into this on a step-to-step basis about why not to worry. All right, so where did the worry start from in the beginning? As in many things, it started with fake news, saying that there is a protein that is in the spike protein, which is the basis of the vaccine, as we described before, is similar to a protein that is in the placenta. All right, this was looked at. If you take any two proteins, you'll find some similarity between them, because you realize that every protein is made out of 20 amino acids. So there's a limited alphabet that's writing this book. But that's, similar to taking any two books and saying there's overlap because they've used some of the same words in them, okay? So that in itself makes no sense. And the fact that the body is making antibodies at the time a woman is pregnant is not a problem, because that's what the body's supposed to do. It's supposed to make antibodies to foreign proteins. So that whole thing was a fake news. On the other hand, we do have reason to think that the, SARS-CoV-2, the COVID-19 vaccine itself, could be affecting fertility. And as in everything where we're busy trying to balance the vaccine against the disease seems to have a bigger risk than the vaccine. Okay, any fertility questions, Eliana, specifically?
Yes. Well, besides the fact that, one of the questions that just came up now is, since this is all a relatively new story, is it too early to determine this is fake news, or is it just that it was scientifically completely without basis?
It scientifically just doesn't make any sense. Okay, so it's
Thank
not
you.
not a reason to work. Okay. Okay, so that gets to the next step, okay, in terms of we don't think that the vaccine does not affect fertility, the disease does, therefore it is better to be vaccinated. Well, if I'm planning pregnancy, should I be waiting till a certain time after I have the vaccine before I get pregnant or not? And here too, the science is there's no reason to wait. Okay, we don't have any reason to fear this vaccine. Don't have any reason to think that it would be possible for it to produce any kind of birth deformities, because as I explained at the beginning, it has no virus, not a live virus, not weakened virus, not even part of the virus. So it makes no sense that it could cause any effect on the developing fetus. In addition, the way the vaccine is given, it's given inside muscle tissue, and it disintegrates in about a day. Okay, basically the body's immune system reacts to a foreign protein that was there for about a day, or not a foreign protein, about the foreign protein that was made by this recipe that was given, and the immune system is meant to work during pregnancy. And we do have many other vaccines that are given during pregnancy, such as tetanus, such as pertussis, such as influenza. And therefore, there really is no reason to fear the virus. On the other hand, there is reason to fear COVID-19 in pregnancy. From the beginning of the epidemic, we've been saying that pregnant women, at the beginning, we're saying that pregnant women did not have more serious disease than non-pregnant women, but a big study that came out from the CDC showed that the difference is small in absolute numbers, but there is an increased risk, okay? And therefore there is a biological reason to worry that the woman's corona will be worse because she is pregnant. We're very worried about women getting influenza while they're pregnant, because trying to breathe while you're pregnant is a little bit challenging enough, and adding other things that challenge your lungs is often not a good combination. But even if we leave out the serious implications of COVID-19, the implications of giving birth while one is positive for corona are really ones the one wants to avoid. The woman is often left in an isolation room, often separated from her baby, even though that is not medical recommendations that she needs to be separated. If she's left together with her baby, she's often not getting the support that a postpartum woman needs and deserves. So there's a lot of reason to try to avoid COVID-19 while one is pregnant. Okay, now back to planning pregnancy. The CDC itself came out beginning of January and said routine testing for pregnancy before Corona-19 is not recommended. People who are trying to become pregnant do not need to avoid pregnancy after receiving a Corona-19 vaccine. And in Israel on January 18th, the National Council for Gynecology and Neonatology and Genetics released a statement where they said there is no reason to delay pregnancy before someone is getting a corona vaccine, and that includes women who are going through fertility treatments. Okay, which leads me to a minute of saying something about fertility treatments. As far as timing of the vaccine and the treatments, the official policy is that one can continue one's treatments and one can get vaccinated when one can get vaccinated. In all kinds of situations, one can discuss it with one's healthcare provider, if it's a matter of waiting a day or two or something, but there is no official reason that one has to delay the vaccine because one is undergoing fertility treatments. And they're, yes, maybe one will get a flu-like symptom and one will have a little bit of fever from having it, but it'll be from the vaccine. It won't be for a virus, and there's not a reason to think that it is going to cause any problems in the pregnancy itself. Now, why is there so much talk about pregnant women? Why are there so many questions coming in? Because this is an example of one things where the knowledge and the recommendations changed and changed rapidly. So just you're not getting tested on these particular dates, but just to give you a sense of how rapidly things changed. When the shot first arrived in Israel, and the first recommendations were given on December 16th, the Ministry of Health said that because we don't yet know about pregnant women, as of today, we do not think that pregnant women should get. All right. It was never a decision that, oh, they'll never get, but we're starting. Let's not make them first priority. That was December 16th. Already by December 21st, there was data coming in from other countries. The concern was like, what are you worried about? It doesn't make sense that there should be any kind of problem. And therefore, already the recommendations were there was no reason to prevent immunization for women if they were interested, especially if they have risk factors, okay? Because the reason that it came up so often is you had a lot of pregnant nurses, doctors, other healthcare workers who were kind of being put in a difficult situation of deciding, like, can I get this vaccine? I'm at risk, whatever. And therefore, within a week, okay, they changed the recommendation that there's no reason to prevent it. Okay, and already by then they said there's no recommended waiting time after vaccine until attempting pregnancy. And to make it even further clear, there's no reason for a woman to abort a pregnancy if the woman was vaccinated before, during, after, etc. By December 20th, all right, the Israel Gynecology, Obstetrics and Gynecology Society came out and said there is, it wasn't tested officially, but there's no logical reason to worry about it. Yes, in Britain and Canada at the beginning, they said we don't have data, we won't let them do it. But on the other hand, in the States, both the Center for Disease Control and the American College of Obstetrics and Gynecology said that it can be given, and therefore we feel it can be given. Okay, and therefore by December the 24th, it says there is nothing to prevent the immunization of pregnant women, okay, as per the ACOG and the CDC. The CDC said it again on January 7th, and therefore by January the 18th, the recommendation was made even clearer, saying we actually recommend vaccinating pregnant women. Part of the change to recommendation is in the month of January, there were another pregnant women who, who died and had life-threatening kind of situations. It could very well be because the numbers were getting higher. So as the numbers get higher, the more people that you have that could potentially have complications, and therefore it was felt that we want to actually recommend vaccinating pregnant women. And this same council said that it can even be done in the first trimester. If you happen to be somebody who is locked up at home and not going anywhere, you can consider waiting to the second trimester. But as there are very few women who are actually staying at home doing nothing at these years, in most cases, vaccinating sooner rather than later is the better choice. Okay, so by January 20th, the pregnant women was actually put into the highest priority group. And on January 21st, the Ministry of Health sent out a letter that was meant to be given out to all pregnant women, encouraging them to get the vaccine. So yes, back in December, there was some hesitation at the very beginning to say, should pregnant women have it? That hesitation wasn't based on any real scientific reason to be concerned, just like, let's do one step at a time. But within a month, it's changed to, it is very much recommended that pregnant women get the vaccine. Okay, do you have any specific questions on
Yes, I
pregnancy
do.
before I go on to breastfeeding?
Is there any data for babies of women who had COVID when pregnant? And, you know, in other words, did the babies get affected if the women had COVID either during pregnancy or birth? Or
Right.
if the babies
So
were
at
born
this
with
point,
COVID?
we don't know any, fine. So at this point, we don't know about any congenital COVID syndrome, okay, in terms of preventing any kind of, birth defects. A number of babies who had corona positive mothers were born early, very often iatrogenically early. In other words, they were delivered early because of the mother's health. At first, they were saying that babies cannot get infected during pregnancy from their mothers. This has shown that it can happen. Okay, it's rare, but it can happen. So I would say in general, we would much rather pregnant women did not come down corona, more for their sake than for the sake of the baby. But if somebody, is pregnant and did get it, the outcome for most infants has been good, although there was the first fatality about a week ago of a newborn.
Okay.
Okay, and last but not least, we'll go on to breastfeeding. Here also, that first letter that came out from the Ministry of Health said that it should not be given to lactating women, and everybody was like, why not? Okay, it makes even less sense. Okay, when we're pregnant, we have a developing fetus, and you could try to think, I don't want to take any chances whatsoever, because there's so many things we don't take chances of in pregnancy. But in breastfeeding, it made no sense that there should be a risk from this vaccine. Take the worst case scenario, if the woman is sick and she has the virus herself, it probably doesn't go through the breast milk, but even if what would go through the breast milk, we're still telling her to nurse. So how could antibodies be worse than whatever? So that it didn't make sense. And second of all, it may even be that the antibodies that the mother is getting from herself being vaccinated may help protect the child. That was a statement that came out already on December 14th by the Academy of Breastfeeding Medicine. ACOG also in December came out and said that COVID-19 vaccines should be offered to lactating individuals, similar to not lactating individuals. Okay, if they fit in the category that they're supposed to get it, whether they're breastfeeding or not, should make no difference whatsoever. And by December 21st, the Ministry of Health had said that lactating women can get it. Okay, so this is it in Hebrew, like you can get a vaccine if you want. So it's a total non-question. Any specific questions about breastfeeding, Eliana?
Nope, we're good with serology.
Okay, so the last thing that I will mention, and I'm not going to everything that has to do about serology, but rather the interaction between serology and vaccination. And I'm dividing it up into two sections. One is serology before vaccination, the other serology after vaccination. All right. As I said before, if we know you've had the disease, you should not be vaccinated. Therefore, but we're not worried if we do it. So there's no reason to do it beforehand. If we know you're positive, we don't vaccinate, but there is no need to do serology before vaccination to know one's status to decide if to vaccinate or not. The second question has to do with serology after vaccination. There is no reason to do this test. It doesn't tell us anything. As I mentioned, the vaccine not only affects your antibodies, it also affects other things of your immune system. So the fact that you don't have antibodies does not mean that you didn't react to the vaccine and therefore you're most likely to get sick. We see this in other vaccines as well. Once upon a time, they used to test women after every single pregnancy to see if she had antibodies to rubella, to German measles. Now the feeling is that the fact that you've had 2 MMR vaccines means more to us than your antibody levels, because if exposed, you may very well make antibodies. And that's the same thing that we feel about this vaccine. The fact that you've had the 2 doses of vaccine in the manner that you're supposed to have it tells us more about the efficacy and the likelihood of your getting sick than any antibody levels should have it. So there is no reason to do serology after vaccination. And
is there any significance? I'm going to ask the serology questions now, and then I'll ask the general questions that are left over. Do people with lower antibody counts have more chance of reinfection? Once you're positive, is there a significance to the number?
Right. As far as we know, once you're positive, there's no significance to the number.
Okay. And is there, do you believe that the current state of serologic antibody testing is accurate? Does it measure to all the different strains that are going on now?
So there is no, first of all, I'll point out that nobody has proven to this point what the implications are to the serology tests that exist at this point. So we are using them as a proxy for vaccine for the fact that you don't have to go into quarantine, but that's it. Okay. And that's all we know about serology. It's a useful tool for research. It's used for those purposes. But one should not read more into it than we do at this point, which is that it helps you in not having to be quarantined under certain circumstances.
Okay. Okay, now we have general questions. I think all the other questions we had for serology you answered. I have a few questions. I'm going to actually answer a couple of them myself because they're gap year questions. How will the vaccine affect gap year students' ability to re-enter the country after Pesach? So a lot of students have started getting vaccinated, and the answer is this is not a Ministry of Health question. This is a question for the Ministry of Interior, for MASA, for the schools. The schools have to get reentry permits. And of course, we don't know what the policy will be in terms of the airport being open or closed. As we all know, Israelis aren't even allowed into the country now. So if you have a certificate of vaccination, which all Kupot Cholim will give you, it's in your accounts online, then that will count the same for anybody who has it. Will students who test positive for COVID be eligible for vaccines at some point? And the answer is it's not available for Israelis right now. When things change, then there's no reason to think that someone who's not eligible for a vaccine won't be able to get the vaccine. But right now, people who've had corona are not eligible to get the vaccine, and that may change, of course. But you know, it's a little early.
It may or it may not.
It may, right?
You know, because like
things can change. We just don't know. And if someone in a yeshiva, this is for you, Dina, if someone in a yeshiva tests positive for one of the variants, does everyone have to quarantine even after they've already had COVID or they had the vaccines?
Okay, so at this point, with the variants that are known to us today, we are treating them that immunity to one leads to immunity to the other. The biggest difference that we're seeing at this point is the rapidity of spread with some of the newer vaccines. We are not seeing that it means that you can get it again, but these are part of the things that one has to stay on top of all the time because things can change.
Okay. Do you have general suggestions for strengthening your immune system to help people repel COVID-19 more effectively?
I would say all the things your grandmother probably would have told you to do. Get a good night's sleep, make sure you're exercising, try to eat healthy, all kinds of things to keep your body in good, in good kind of shape. There's some indication that, taking vitamin D to prevent having low vitamin D levels may be helpful. But beyond that,
if people are actually staying home and not getting a lot of sunlight, probably not a bad idea anyway.
Right.
Right. What are the options for people who are bedridden to get the vaccine?
This is something that needs to be arranged through their kupa.
So they're
Okay.
Coupa is responsible to arrange for them
The
to get the
Coupa is
vaccine.
responsible to arrange it. Different Coupa do it in different ways, but it is something that, is possible.
Can I get the vaccine, 2 different doses of the vaccine in 2 different countries?
Well, you have the problem that it won't necessarily be recognized in Israel, because at this point we are only recognizing the ones that are given in Israel. So,
Okay. Another question, and this is the hot topic of the month. If we have the highest vaccination rate in the world per capita, why do we have continued high numbers of new cases and deaths compared to less vaccinated European countries?
because there's a race going on, and on the one hand, we are vaccinating lots of people. However, to be able to the point that that the virus cannot spread, we need to get a lot more of the population. As I mentioned, part of our population can't be vaccinated because they're children, and in this we're different than other countries because we have so many children, Baruch Hashem, in this country. And some of these new variants and the pace at which they are spreading has made it more challenging than we expected it to be. I don't think in any way it shows that the vaccine is not effective or that the vaccine is not part of the strategy. It just means that unfortunately the strategy is taking longer than maybe we had hoped back in November.
Absolutely. What are the implications of school reopening with children not being vaccinated? This is your area.
That one has to worry about having spread of the disease exactly like we've had every other time we've come back from late lockdown. And that is why we have to hope that this time it will be done in a stepwise fashion, starting with the lowest risk groups, which are the youngest groups, the Ganim. The one thing that may help us in this is the fact that the teachers are vaccinated at this point could help with some of the spread of the disease, because many school outbreaks involve spread from teachers to students and around like that. So hopefully that little part will help us, but it means that we really need to be careful when they're going back to school. Hopefully making surroundings like smaller classroom, less children in the classroom at the same time would probably make a major contribution to reducing the illness.
If someone has had corona and they're still having some respiratory symptoms weeks later, are they still contagious?
In general, the feeling is no. We feel that after the first week is over, most of the contagiousness is gone. But to decide when somebody, can get out of, can be released from the house includes a conversation with the doctor to see how sick he was in the last 3 days. So if he had a really bad cough at the beginning and he has like a improving, lingering cough, that is not considered a reason not to do it. On the other hand, if he's still sitting there like hacking, then he's not yet better yet, and he can't come out till things have gotten a little bit better.
So more severe symptoms.
It's the severe symptoms, and it's partially in terms of, are we in the improving direction, or are we on the not in the improving direction?
Okay. Great. This has been extremely helpful. I appreciate your time very much. There are a few other questions that we will try to get to after, but Dr. Zimmerman works about 15 hours a day. So we will get to that and get that information out to the WhatsApp groups. I really appreciate that you joined us today, Dina. It was extremely helpful. And I'm sure that this has provided a lot of good information to people. If people can please fill out the survey to tell us if this has been helpful, that would be great. And a copy of the recording will be available to everybody who has signed up for this chat. So thank you very much for joining us. We really appreciate it. Okay. Oh, someone's even clapping. Very nice. Okay.
Okay, I'm signing off. Lila
Thank
Tov.
you, Lila Tov.
Bye-bye.